A dry cough is a type of cough that does not produce mucus or phlegm, which is why it's often called non-productive. When you have a dry cough, there's no mucus buildup to expel, and the cough is often triggered by irritation in the throat or airways. This type of coughing is often described as a tickling sensation in the throat or chest that leads to repeated coughing. The mechanics behind a dry cough are fascinating. Your respiratory system has special nerve endings called cough receptors. When these receptors get irritated, they send signals to your brain's cough center, triggering the cough reflex. With a dry cough, these receptors are being stimulated even though there's no actual need to clear your airways of mucus or foreign substances. The sound of a dry cough is pretty distinct from a wet cough. It tends to be sharp, with a persistent bark or harshness. This cough may be accompanied by a sore throat due to the constant strain on the throat muscles, especially if the cough continues over a prolonged period. Types of dry cough. There are two main types of dry cough: acute and chronic. An acute dry cough lasts for a short period, usually less than 3 weeks. This is the kind you might get with a cold or flu. In contrast, a chronic dry cough lasts for more than 8 weeks and may be caused by underlying conditions such as asthma, acid reflux, or chronic obstructive pulmonary disease (COPD). Causes of dry cough. There are numerous causes of dry cough, and they can range from mild, temporary factors to chronic health conditions. Number 1. Viral infections. One of the most common causes of a dry cough is viral infections, such as the common cold or flu. During these infections, the respiratory tract becomes inflamed, leading to coughing. Even after the primary symptoms of the infection, like congestion or fever, have resolved, a dry cough can persist for weeks as the airways remain sensitive and irritated from the infection. Number 2. Allergies. Allergens such as pollen, dust, mold, or pet dander can trigger a dry cough in people with allergic sensitivities. When exposed to these allergens, the immune system releases histamines, which can lead to symptoms like sneezing, runny nose, and a persistent dry cough as the body tries to clear the irritants from the airways. Number 3. Asthma. Asthma is a respiratory condition that can cause a chronic dry cough, especially in a type known as cough variant asthma, where coughing is the main symptom. In asthma, the airways become inflamed and highly sensitive, leading to a persistent cough, often triggered by cold air, exercise, or exposure to allergens. This cough frequently occurs at night or in the early morning. Number 4. Acid reflux. Acid reflux is another surprising but a common cause. When stomach acid travels up your esophagus, it can irritate your throat and trigger coughing, especially at night. This is why some people with chronic dry cough might not realize it's actually related to their digestive system. Number 5. Postnasal drip. Postnasal drip occurs when excess mucus from the nose drips down the back of the throat, irritating the airway and triggering a cough. This can happen due to allergies, colds, or sinus infections, and often leads to a dry, tickling cough as the body tries to clear the throat of mucus. Number 6. Environmental irritants. Exposure to environmental irritants, such as cigarette smoke, air pollution, or chemical fumes, can lead to a dry cough. These irritants can trigger your cough receptors, leading to a dry cough. Number 7. Medications. Certain medications, particularly angiotensin-converting enzyme inhibitors used to treat high blood pressure, can cause a persistent dry cough as a side effect. Approximately 10 to 20% of people taking ACE inhibitors experience a persistent dry cough. This medication-induced cough usually begins shortly after starting the treatment and resolves once the medication is discontinued or changed. Symptoms of dry cough. A dry cough often feels different from a productive cough because there's no mucus or phlegm to clear. The cough itself is typically sharp and dry, creating a barking or hacking sound that can be quite loud. The most common complaint with a dry cough is that irritating tickle in the throat that just won't go away. It's like having an itch you can't scratch, and the more you cough, the worse it gets. Many people describe feeling a scratchy or raw sensation in their throat, especially after episodes of coughing. Your voice might become hoarse, and you might feel a burning sensation in your chest or throat. The constant coughing can lead to muscle soreness in your chest and abdomen, and you might even develop a headache from the physical strain of coughing. Some people find their dry cough is worse at night, making it hard to sleep. Others notice it's triggered by specific activities like exercise, talking, or laughing. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment and home remedies for dry cough. The treatment approach depends on the underlying cause, but there are some effective home remedies to manage and relieve the symptoms. Number 1. Over-the-counter cough suppressants. If your dry cough is keeping you up at night or interfering with daily life, an over-the-counter cough suppressant can help by calming the cough reflex temporarily. These medications typically contain ingredients like dextromethorphan, which reduces the brain's urge to cough, offering some relief, particularly when sleep is disrupted. However, they are not recommended for young children without medical advice. Number 2. Saltwater gargle. Gargling with salt water is a simple and effective remedy, especially if your dry cough is accompanied by a sore throat. Dissolve a teaspoon of salt in a glass of warm water, then gargle for about 30 seconds before spitting it out. Salt water reduces inflammation in the throat, which helps ease soreness and coughing. Number 3. Honey. Honey is well known for its soothing properties and can be particularly effective in calming a dry cough. Its thick consistency coats the throat, reducing irritation and easing the urge to cough. Adding a teaspoon of honey to warm tea or water can offer immediate comfort, especially before bedtime. Honey also has mild antimicrobial properties, which can help with any minor throat irritation. However, honey should never be given to children under 1 year of age due to the risk of botulism. Number 4. Use a humidifier. Using a humidifier in your bedroom can make a big difference, especially at night. Dry air can irritate your airways, so adding moisture to the air often helps reduce coughing. A humidity level of around 40 to 50% is ideal for comfort and respiratory health. Remember to always keep the humidifier clean, as unclean humidifiers can circulate bacteria or mold, which can worsen respiratory symptoms. Number 5. Stay hydrated. Keeping your body well hydrated is one of the simplest yet most effective ways to ease a dry cough. Water helps keep the throat moist, reducing irritation and the urge to cough. Warm fluids, like herbal teas or warm water with lemon, are particularly soothing. Aim to drink at least 8 glasses of water daily and increase this if you're in a dry environment. Number 6. Avoid allergens. If your dry cough is triggered by allergies, reducing exposure to allergens can be beneficial. Regularly washing bedding, closing windows on high pollen days, and using an air purifier to reduce indoor allergens can minimize symptoms. Additionally, rinsing your nasal passages with a saline solution can help flush out allergens, reducing postnasal drip and the associated dry cough. Number 7. Address the underlying issue. For lasting relief from a dry cough, it's essential to address any underlying conditions or triggers that may be causing it. For example, for individuals with asthma, quick relief inhalers containing bronchodilators like albuterol can open the airways and relieve coughing episodes. If acid reflux is contributing to your dry cough, simple steps such as elevating your head while sleeping, avoiding spicy or acidic foods, eating smaller meals, and waiting at least 2 to 3 hours after eating before lying down can reduce acid reflux. For additional relief, over-the-counter antacids can neutralize stomach acid, while H2 blockers or proton pump inhibitors, prescribed by a doctor, reduce acid production and protect the esophagus. When to seek medical advice. If your dry cough lasts longer than a few weeks or is accompanied by other symptoms like shortness of breath, chest pain, or unexplained weight loss, it's essential to consult a doctor. Chronic dry coughs can sometimes indicate underlying conditions, such as asthma, COPD, or infections like tuberculosis, which require specialized treatment. A thorough evaluation can help identify the root cause and lead to a tailored treatment plan for long-term relief. Now, we want to hear from you. Have you ever dealt with a persistent dry cough? What treatments or remedies worked best for you, and how did you finally find relief? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.